With us today is Gretchen. Today we will explore the role of music therapy in care and communication.
Being able to observe a music therapist using her voice, using the guitar for procedural support of a pediatric patient, grounding the parents and the medical team. It was just a powerful human experience. I had no idea the arts could be used so closely. Music is unique in that it activates both hemispheres of the brain. So it just happens to be that people with dementia, Alzheimer's, can recall full song lyrics, but if you were to just verbally say, what's today's date, they would not be able to respond with the date in June. Music therapy can be transformative because it offsets that extra burden of just talking through really heavy content. Roughly over 10,000-ish music therapists in the country, so there's definitely a need for more music therapists.
Welcome, everyone. I am Rachel Nash, board certified patient advocate, and I'm honored you'll be joining us for another episode of My Patient Advocate. With us today is Gretchen, the founder of Piedmont Music Therapy. Today we will explore the role of music therapy in care and communication, what advocacy looks like in a creative clinical setting, and how Gretchen's work is helping others find their voice, even when words fall short. Hi, Gretchen. It's great to have you here today.
Good morning, Rachel. Thank you so much for having me.
Thank you. Can you tell me a little bit about yourself and your background?
Sure. So I'm a nationally board certified music therapist. To become a music therapist, you have to receive a college degree and complete an internship to sit for board exams. So my credentials are MTBC, Music Therapist Board Certified. I received an undergraduate degree from Duquesne University in Pittsburgh, Pennsylvania.
Okay.
So I am a Steelers fan. And then my master's degree is in social work direct practice from University of Pittsburgh.
Wonderful.
So that's the training before more clinical experience out in the field.
Tell me a little bit about you as a person.
And I'm born and raised in South Carolina and happy to return back to the South to be closer to family. So that's important to me.
That's great. So you've built a career at the intersection of music, health, and education. What led you to the field of music therapy?
I stumbled upon it due to a sibling exploring music therapy. That was actually her college degree choice. I really just wanted to attend a music conservatory. So viola is my primary instrument. Viola is kind of like a violin, just a little bit larger, still played on the shoulder. And I was looking at conservatories just to perform for the rest of my life. But between my top two choices, I didn't get into those, but Duquesne did offer federal scholarship dollars. So as an out-of-state student, I began at Duquesne as a music performance major and then was allowed to audit for like 0 credits the Intro to Music Therapy course. And so literally sitting in as a college freshman, I quickly said, I want to dual major, which was a challenge with a performance degree as well. And being able to observe music therapy as a freshman, you had to do clinical observations in the community. And one of my first ones was permitted through the Children's Hospital in Pittsburgh, and being able to observe a music therapist using her voice, using the guitar for procedural support of a pediatric patient, grounding the parents and the medical team. It was just a powerful human experience. I had no idea the arts could be used so closely. So I quickly said, this is what I want to be able to use my musical talents towards learning more about it. So thankfully, the undergrad program I enrolled in did allow clinical experiences early into your undergraduate degree. Some colleges, it's not until junior, senior year, but early on, I was able to see music therapy used more like at a group home for stabilization of people with mental illnesses. And music therapy was one of the group programs for socialization and emotional support. So being able to see it in a variety of settings was really educative for me, because I had no idea the power of music therapy, not just music, but when used by a board certified music therapist that's very goal oriented, with progress notes and an evaluation.
So, does your sister also, is she also a music
She maintains her credentials, but she pursued pedagogy for her doctoral degrees in piano pedagogy. So she teaches at a university. So she is a great collaborator in regards to continuing educational courses. So the organization I work for now, Piedmont Music Therapy, of which we so appreciate your volunteer work as a board member. We provide music therapy treatments, studio lessons, and educational programs, which includes educating other music therapists for their 5-year cycle of continuing ed programs. So PMT is a national provider of continuing ed. So yes, she has proctored those courses before, which I certainly trust her level of skill as an educator, because teaching in a college is you have to be very organized.
I'm sure.
Yeah.
So the first experience that you had seeing how music therapy impacted the patients, what did you feel?
I think afterwards I was very emotional, just thinking how fortunate my own feeling was with my nephews and nieces, never needing to be inpatient before and learning how some kiddos, their length of stay has been years due to their medical conditions. And I had never witnessed someone have such a challenging deck of cards handled, and all the important needs for resources and interventions to support quality of life, both for the patient, the caregiver, siblings, all those people impacted.
I definitely hear the passion. Can you tell me a little bit why the board certification is talk a little bit about that, the need to be board certified?
Yeah, well, I think with the arts, there's an important ethical boundary one needs to be aware of. The arts can be very invasive, and when we're dealing with someone that has trauma in their background that may not be able to communicate with words, it's really important that the provider uses due diligence to not cause harm. And the arts can, that one song can elicit all the senses and all the emotions from the first time one heard it. So whether that's through a divorce or a challenging time one experienced, that's part of the preparation clinically I have to do as a music therapist prior to working with someone. So that way there's no harm done, right? And so a lot of music therapy includes consent paperwork, intake paperwork to learn about preferred artists or genres. Research does show that music that's client preferred is more engaged on one's brain literally, for all that great cognitive work. So the board certification ensures that musically I can play a variety of instruments on a daily basis, but also stay informed on the research and the theory behind psychological expressions, a lot of different things, especially for group dynamics. My first job was at a hospital, inpatient acute psychiatry and dual diagnosis. So facilitating group sessions on a highly sensitive unit. Admission requirements were dangerousness to self or others. So music therapy allowed people to be acknowledged for who they were, and it allowed the treatment team to get to know them a little bit and let their guard down again in that human experience. So that would not be a role that anyone can just walk into without proper training. And the individuals that was my first work as a music therapist board certified, I needed to seek supervision as well, since these are really intense stories and people are generally willing to share that story if you give them that space. So I needed to make sure that I was taking care of myself, because it was very intense personal stories that people were willing to share what they had gone through thus far as adults.
Right. Well, I asked that because I certainly don't want people to think they could just do it at home. So that could, I love music, and they think that because it is multifactorial. Right. There's so many things you really have to understand.
Yeah.
Trauma.
Right.
And music brings us back to so many different times in our lives. There's certain songs, Gretchen, I just can't listen to
Right. Yes.
because I think, oh gosh,
Yeah.
that happened.
Right. And I think culturally it seems that we tend to overuse the term therapy or therapist, whereas retail therapy, aromatherapy. So that's part of the educational side of our mission, is to gently explain our purpose and our higher training qualifications. But that's not to say the world doesn't need music entertainers and performers and volunteers willing to share the performing arts aspect. But generally in our sessions, it's a little bit more highly involved and interactive.
Okay.
So a music therapy session is not the stagnant watching a YouTube screen. We're actually using real instruments, whether it's percussion, because that's easier success rate. No one needs to have any prior experience to be able to strike a drum or hold percussion instruments. We also use ukuleles, guitars, keyboards, or piano, just depending on the setting. So,
Thank you for that. How has your academic work at Queens and Winthrop shaped the way you lead and mentor today?
yeah, Queen's University of Charlotte, the Royals, that's our closest undergrad degree program to be a music therapist. I learned a lot working with undergraduate students, both as a supervisor and a music therapist. I think students bring a lot of curiosity, a lot of energy and enthusiasm. So that was really valuable and helped shape me as far as how I communicate and the feedback I provide. Through Winthrop University, I'm a remote adjunct faculty member of the social work department. So I have the opportunity to support MSW students that are pursuing their internship hours. So I really just assist them to make sure they're taking care of themselves, they're keeping up with paperwork, they're receiving professional support from a supervisor on site while cheering for this Ewell, right? That's about to leave the university setting. So Winthrop has been wonderful since my master's degrees in social work. I like to use all of that learning because social work has been around a lot longer as a field than music therapy. So there's so much that I learned from my social work degree in regards to human systems, counseling. I mean, just a lot of great learning that I didn't get in an undergraduate degree program.
Just like with all healthcare systems, I'm just curious, do you think social workers are they burned out after so many years? Do you stay on top of what that looks like for social workers?
I don't have a good pulse on that, but I tend to think personally everyone is in a frazzled state, whether that's the educator, the administrator. I do have children in a public school system locally, so I think across the board, no matter who I encounter, there's such a high level of stress. Okay, that common lay people are saying burnout, right? Whereas years ago, I don't think that was such a buzz term. So hopefully that's good that people are more aware of it. But I don't know how our communities in general with proactive measures to decrease burnout and to share that with our youth so they understand what we're going through, right? To help them learn, right? That introspective, like, oh, okay, I'm noticing I'm feeling this way. I need to do something differently. So, but that's definitely a challenge of any parent or aunt, right? Trying to be transparent, on oneself.
Here's a question I love because I know you'll have some good stories here. Can you share a client moment where music therapy opened a door that nothing else could? You could share as many as you want. These are my favorite questions.
Yeah, that's a wonderful question. Yeah, that's all I wanted to talk through while maintaining, HIPAA compliance.
So you talk about it in general terms.
Yeah, I think anytime that I witness someone's affect and truly their personality come to life because of that shared moment through music is humbling. Because yes, it's one thing to be patient and to have your own personal qualities, but it's not just that. It's very much that creative encounter through the arts. So two recent programs that a colleague and I were able to co-facilitate was for local veterans. The suicidality rate for veterans in our country is increasingly alarming and not a trend that we should be proud of as a country. So PMT was honored to collaborate with 2 different workshop series to promote coping skill utilization and just to create a safe social setting for veterans through the arts. And some of the veterans that we were able to connect with, just witnessing them vocally improvising and making the blues on various percussion instruments, you wouldn't have thought that at the American Legion Post that would occur. But it was just beautiful just to see that sense of creativity and willingness to play. Because I think each of us still need to foster that creativity and play no matter what age we are. And so that was great just to see that willingness to have some fun, to goof off, right? To flex those other muscles in one's personality, despite all that's defined them and their titles previously. All right. So I can easily recall just that sense of humor and the personality, that lightening of one's affect and willingness to kind of share and explore insurance was definitely cool to witness.
Oh, wow, that is. Especially with our older veterans or Vietnam veterans who were sometimes a little bit more stoic because of how they were, they were soldiers that were told to, kind of buck up and just do your job. And it really wasn't okay to step outside of, to be vulnerable, right?
Yeah, there you go. Anecdotally, really, right, challenging veteran group. Yes.
So what kinds of needs or challenges are best supported through music therapy?
Well, currently, as a private practice, we have a variety of individuals that we serve, and those diagnoses could range from post-traumatic stress disorder, anxiety disorder, ADHD, speech delays, hearing impairments. So, based on the condition, as a music therapist, we usually start with a literature review of what has been shown to help this type of a population, what types of goals are usually worked on. But as far as the interventions, usually we're working on anything from communication skills, self-regulation, self-awareness on one's emotions and that outlet and sharing of expression. Most of our services are individual music therapy treatments, that we do also offer groups. So now that it's summertime, first week of June, we're about to lead several group programs, and we do have one just for young adults. So those participants are really just seeking a way to kind of further develop social skills. And when you put a bunch of instruments in a group setting, that's a great way to problem solve, right? So there are a variety of goals that can still be worked on even in a group setting. And thankfully, we do have 2 music therapists co-facilitating them just to make sure it's a safe ratio and to also document and keep track of outcomes, right? Like, did someone hit their goal even in the group setting? Trying to record that.
I did, I think it was a year ago, I observed a session with individuals that had dementia.
Oh, yes.
And I was super impressed, Gretchen. I'm just honored to be on your board. He had to be on a board. When someone struggles to communicate the words, or possibly trauma, disability, or illness, how does music step in as a bridge?
Well, music is unique in that it activates both hemispheres of the brain. So it just happens to be that people with dementia or Alzheimer's can recall full song lyrics, but if you were to just verbally say, what's today's date, they would not be able to respond with the date in June. But that's just the intricacies and the magic of our brain and our human development in the system. So music therapy can be transformative because it offsets that extra burdens of just talking through really heavy content. But playing column and response, songwriting with visual aids and other resources to support that individual can be really empowering. And again, acknowledging and validating that person's experience and their preferences.
Now, are you able to, is Piedmont Music Therapy able to go into the hospitals with support patients, and what does that look like?
Yeah, Atrium Healthcare has their own full-time music therapists at multiple hospitals. Yes, there are music therapists at Children's Hospital, Levine Children's Hospital, Levine Cancer Institute to help oncological patients, inpatient or outpatient, to support their journey. And yeah, some music therapists in the Carolinas exclusively work in hospice and palliative care. So they're just helping a person's symptom management and helping the whole family, especially during the active dying process, to normalize and validate all of those emotions that can occur. Sometimes with hospices too, the music therapist can continue to support the family after their loved one has passed, whether it's through retreats like Chameleon's Journey at the local Y, or other support group experiences, just to acknowledge that unique relationship they had over that loved one. But yeah, most of the services that Piedmont Music Therapy provides is an outpatient setting, with the exception of like Charlotte Rescue Mission Delph, a large organization in Charlotte that supports substance use disorders. We work with women in recovery there every other week, meeting a large drum circle for all the residents, which just helps a group of women get along because we're not talking, but everyone's provided a different instrument, which adds to the diversity of all of us getting together as unique individuals. We incorporate songs and chants because that can help with grounding techniques and self-regulation strategies. So that is more of a restricted setting because those individuals reside at that campus. We also have a few partnerships with local memory care units, which would be a locked unit more for advanced dementia or Alzheimer's. And music therapy can just be so calming because that older adult, very much, if you give them an instrument, will start playing before we even get our guitar tuned up or our keyboard ready for the themed songs.
So when our healthcare systems bring in music therapy, do they know, are they bringing in board certified music therapists, or?
Yeah, I believe so. That's usually the intention, just like with dance movement therapists, art therapists, drama therapists. There is a lot of education, but it is up to the state with licensure and title regulations for how that transpires. Georgia, for example, is the closest state that has a licensed music therapy title because that's state dependent on the government system. But that is the hope, that they're getting the most highly trained and qualified individual,
And that somebody that can see sort of all angles, not of the diagnosis, the disability, and the impacts that it could have, and the impacts that it had.
right? Yeah. So, and I still recall that one time. I remember, this was, 13, 14 years ago. One of my patients in the hospital explained this intricate tattoo design and being able to share it with the IDT interdisciplinary team. They're like, "How did you know?" I'm like, he was willing to share.
Right.
And so oftentimes I feel like as a music therapist, we really just start with getting to know someone's name, their preferences. So much of that human experience, especially in the healthcare system, is just very transactional because everyone's on a time crunch and they need to check their systems. But it's really important that we get to know culturally, religious faith background. We need to make sure we're informed,
Right.
to support their preferences and their beliefs.
Right. So it's not someone just going in and saying, okay, I'm going to.
Right. It's like, what I think, and it's going to heal you.
Yeah, just listen to it. What do your sessions look like in practice? So is it structured? Is it improvisational, or is it somewhere in between?
Somewhere in between, for sure. I think it just depends on the goal area, for sure. Like our preschool children, their individual appointments are going to look a lot different than an adolescent who's working through anxiety symptoms, as opposed to an adult that had a stroke and is working more on gait rehabilitation and being able to sing than being able to say their phone number. or their forward request of call my husband or whomever that is that they're trying to communicate their needs. But the commonality is there's going to be musical instruments. It's almost like writing a paragraph language arc. There's an introductory kind of greeting for grounding purposes, and then more of like that protein, really more cognitive focus, whether it's attention duration that we're tracking or just trying to work on extremity range with that kiddo that might have cerebral palsy, and we're really just trying to get that paddle drum up here and having them reach as far as they can with their mallet. And then at the end, though, we're trying to wrap up, make sure we're respecting their time to give a verbal handoff to guardian or caregiver in the lobby so they understand if there's homework for the week ahead, and like next steps for progress.
Okay. You did touch upon building trust, and you mentioned that even though I didn't ask you anything about it. But can you talk about how you approach building trust with the family, the caregivers, and your clients?
We try to be patient and we try to take care of ourselves prior to meeting with the patient or the caregiver. And I think that's really important and often overlooked in a healthcare setting. So we try to make sure that we're informed to ask not just what music do you enjoy, because we should have already read that in their intake paperwork. So we actually try to review anything that say is emailed in, all of their consent paperwork as far as what they've expressed for wanting to work on. Part of our intake paperwork asks, what goals do you want to be working on within all these different domains? So that way we can hear from their perspective if they shared consent to reach out to other therapists, their doctor. We can learn their perspectives as well. So that way, for our expertise, we can then join the conversation and say, this is what we think we would be able to work on related to what we heard so far. And so I think that helps the trust process, because we want to work elbow to the elbow, because hopefully at the end of the day, we want this client to be better in whatever capacity they're wanting. So to us, that's a big part of the trust, is it's a dialogue as opposed to a directive ending in a period. This is what we're doing.
Right. So moving on to leadership, mentorship, and professional advocacy and favorite part. As a founder and leader of a team, how do you advocate not just for your clients, but for your clinicians in the field of music therapy?
I wish that was easy to do, Rachel. I think trying to make sure it's a sustainable work schedule, caseload, trying to offer regular supervision meetings to make sure that requests are heard, that team members are supported with problem solving, and that they're not struggling with something without being asked, how can we help you make that more manageable? For the first time last year, our organization led an internal retreat for staff. And so we'd love to be able to do that at least on an annual basis. So that way it just doesn't force clinicians to take care of themselves off the clock, right? But part of the culture, hopefully, of our team is that we want to hold each other accountable, and when appropriate, professionally to check in if we see that a peer is struggling, because that also helps us practice what we're encouraging out the community.
Yes. So what does mentorship mean to you, especially when working with emerging therapists or students in training?
Mentorship to me means that I'm open to answering questions, to meeting for coffee. I like staying connected within the music therapy profession. I've always loved being involved in any serving capacities. So yeah, I think mentorship is being open to talk. I think that's harder for me because there aren't as many in-person conferences to be able to share coffee with. Now it's more shifted to LinkedIn and technology that I just don't have many routines on those different devices, but that could certainly improve with my own time spending. But yeah, I think I am always open to music therapists that reach out, especially interested in private practice work, because that's just a growing need in our country. There's only roughly over 10,000-ish music therapists in the country. So there's definitely a need for more music therapists. But to help that, specifically, PMT is an internship site. So we welcome 2 college interns a year. And we're really excited. We have 2 lined up, one from Charleston Southern University and one from Belmont University in Nashville, who will be arriving in a few months to work 6 months with us as an intern before they sit for the board exam.
Okay.
So that's a small way that we're able to share what we do and to learn from them, because there's nothing like having a fresh student asking up questions, getting to know their personality. That impacts all of us.
So what are some misconceptions about music therapy that you find yourself always clarifying?
Oh, Rachel, how much time do you have? People are usually surprised to learn that we make music in music therapy. Usually people ask me if I play any instruments. And so I say, definitely, right? If you meet a music therapist that doesn't play an instrument, they're probably not a music therapist. Some people connect music therapy just with 2 different age groups, either people with Alzheimer's disease or older adults in the community, or autistic children with autism. And they just kind of only think of music therapy very exclusively. So I think those are the 2 more common misconceptions that people ask me about.
Thank you. Thank you for clarifying.
Yeah.
How can music therapy be a meaningful part of a larger care team? Because I'm a big believer in teams. And as a patient advocate, my job is to not tell people what to do, but to get people to where they possibly need to go and provide options when it comes to healthcare. So I would assume, what do relationships look like working alongside speech therapists, counselors, educators, and physicians? Is there a team approach?
I think it just depends on people's time, right? But usually if you ask for a meeting, it can get scheduled for virtual or phone call. But that definitely helps inform the bigger picture. Especially as a music therapist, oftentimes we can help generalize some goals, whether it's helping with transition songs that we're using in session that we'll say, hey, let's do a recording so you can use in these other settings. That's a big part of therapy, Raise. Although therapy is great with the clinician, hopefully we're not stuck in a therapy mode for 8 years, right? But like, how can we work on this for that empowerment piece and closure or termination of that therapist relationship? So I think it's possible, but it does depend on the setting. Music therapists could work in a school system, so I do think there's a lot of under-tapped resources just in the academic school settings of K through 12 locally. But just to stay away, I referenced Georgia earlier. There's a district called Fulton County Schools, and they employ over a dozen music therapists just to work in the school system. Really? So when you think of social emotional learning, the arts, I feel, should be kind of in tandem to support that student's academic success.
That is work done. So do you see that happening? Do you see that happening elsewhere? And how does that happen?
I think just advocacy, whether it's the students advocating, the parents, the educators. There are local resources here in the Carolinas. So South Carolina Arts Commission does have available grants that educators can apply to that would hire music therapists or other like vetted providers on their website to support short-term programs. So I'm a big believer that anything can be helpful if that's the intention planned.
Here's a question I love, because I love the word resilience. And I did want to just, before we go there, sorry, I'm going to take you back. I love how you mentioned empowerment, because the goal is to not be there forever, right? Mm-hmm. It's to truly empower someone so they can have it for themselves. Is that correct?
Yeah.
Is that how you would?
Yeah, definitely support that explanation of it.
So how has music therapy helped build emotional resilience?
Well, lyrics can be so transformative and so powerful. So sometimes being able to connect how one's feeling to either writing one's own song, singing a song, to kind of validate one's own emotions or emotions that they'd like to be able to express more genuinely outside of the session.
Yeah.
But yeah, resilience, I think we're all hopefully trying to attain somehow, right, on our capacity personally.
What's it like when someone's hesitant at first?
I think sometimes we're all trying to protect our own self. So I think sometimes that reluctance or hesitancy is because they don't want to be hurt further.
Yeah.
Or they're not sure how they're going to be judged or further stigmatized. So the music therapists at Piedmont Music Therapy are encouraged to respect, to validate, even if personally we might not have the same beliefs, food preferences, political preferences. We kind of take an oath as a music therapist. We're still going to show up for that client. And so I think that's with any healthcare person, right? Then genuinely, when you're showing up, that is your job expectation, and it's not going to be easy, right? If what you're hearing, especially in the South, is not what you would ever repeat, but that is part of our pursuits, is to support that individual.
Right. And sometimes that individual, you're able to reach more in some ways, that hesitancy in the beginning, and then at the end. Yeah, thank you. Yeah, right. So we're going to look ahead a little bit. What is your dream or vision for the future of Piedmont Music Therapy?
Oh, wow. Well, Rachel, part of our strategic plan is if we had a beautiful, fully accessible space. And when we say accessible and inclusive, that means it's fully ADA compliant. So currently we house and host a regular drumming class for individuals with Parkinson's disease. But our entryway, you need to be able to manually open it, put like a wooden little wedge under it to hold the door open. So thinking of like our public library systems that kind of has like a wave or like a sensor to open the door, so anyone with a physical disability could enter it independently, would be golden. But yeah, we love to be able to work with more clients and more interns. We had to give several declines recently for our November position because of the physical space. We just didn't have enough desk space for practicing and documentation space. So big picture for Piedmont Music Therapy is to have more opportunities for people to access music therapy, whether it's individual sessions that are funded for adults since it's not covered by insurance. We'd love to grow the donor base so that way if your loved one's 18 or older, we have available funds to cover at least a quarter of treatment, which has 12 weeks, 6 in sequence, as well as more workshops. That's kind of like a short-term program for young families, whether it's going through foster care. There's just so many different diagnoses and conditions that people are navigating. And it'd be great if they could get to some creative arts to kind of think of it differently and use metaphors and creatively to get through it.
Are there any particular populations that you're not serving that you wish you could get to, that you're maybe missing, or they're not by your...
Well, thanks to Google, lots of people find us through searching closest music therapists to me. So I do feel grateful that we have the technology we do for people to be able to contact us. They can text us, call us. But we do try to keep current on Instagram, Facebook, just for the different age groups of people curious about services.
But get ready for this next question. I love this question. Okay. And I wrote it. No, but if you could send a message to healthcare leaders or educators about the value of music therapy, what would it be? What would you say?
That they should definitely have a music therapist working with their patients or clients.
Okay. Yeah. Now we're moving on to the quick fire round. Yeah. So this is fun.
All right. So how fast do we have to go here?
Well, not that I'm competitive, but
Is there a record we're beating?
nope. But just a couple questions. Yeah, you're gonna say, and this is kind of off topic. Okay, fun. So guitar or piano?
Piano.
Okay. Coffee, tea, or something stronger?
Coffee.
Okay. Early bird or night owl?
Truly I'm both, but I need to be better at early bird.
Okay. Favorite musical era? 70s soul, 80s pop, 90s alternative, or something else?
Yeah, I would do 90s alternative.
Okay, yeah, that's fine. The song that always uplifts your mood.
Beatles, Obladi, Oblada.
Okay. Go-to karaoke song.
No, I'm not a karaoke person.
Not at all. Okay.
So terrifying to think of.
I know.
Probably Aretha Franklin.
Okay.
Respect.
I think it's like strong. Comfort food after a long day.
Sliced apples with peanut butter.
Crunchy peanut butter. That sounds good. What's one thing that's always in your therapy bag?
Eye contact.
Okay. Favorite quote or lyric that keeps you going?
Ooh, wow. That's all right. We can think about that one. Yeah. Bridge over troubled waters. I think that's a beautiful metaphor. Everyone's gonna have something going on, so we're just trying to have some sort of bridge, even this temporary, to get a bit of rough time.
That's true. That's true. Music venue or place for a session? What about the Space 3 music venue? Ah, I forgot that word. Oh my, the different kind music venue or place for a session.
Isn't that really hard? I mean, I once observed an early childhood music therapy program at the Rock and Roll Hall of Fame in Cleveland, Ohio. And they bussed in kind of like Title I youth just to be able to work with music therapists all throughout the museum for pre-literacy program. So if we could replicate that through like NASTAR, their museum in Charlotte, I feel like that would be a win culturally for our area.
Absolutely. Absolutely. All right. So one non-music hobby you love.
Ultimate Frisbee.
Oh, really? Yes. Okay. Tell me about that. What is that? Is that just
So it's not disc golf. It's like a plastic disc. I played through a Christian League war in Rock Hill in the fall. So it's a co-ed team, but it's a non-contact cardio sport. Super fun. It's challenging on the knees as one ages or your ankles, but fun time to exercise in a group environment.
the most used app on your phone right now?
Probably Messenger.
Okay.
Like our text messages.
Secret talent people don't usually know about that you have?
I'm very good at playing Dr. Mario.
Oh,
The video game.
the video game?
I can really
Wow.
proceed through metrical levels that aren't available.
Real serious, but you just keep going. Yep. Off 20. Yeah. A moment that made you laugh in the session, but you just couldn't stop laughing.
I still think about the ridiculousness. I accidentally said a wrong word in a lyric with someone years ago, and the word was part. But instead of saying part, I said something else related to flatulence.
Okay.
And this older adult couldn't stop laughing. I was mortified. I don't think I could laugh about it until a few days later. But I always think back at just how easy you can alternate a lyric unintentionally.
Right.
And so it wasn't the outcome I was planning, but thankfully they were flexible with me that I was a human. So yeah.
One thing that brings joy to you, just for you.
I enjoy baking. I think it's very nice to make time to bake something.
Okay. What do you bake? I mean, cakes. Do you bake big cakes?
More like oat stuff, like really hearty stuff with like flax and
Yeah.
But yeah, I like baked breads. More like bars, like casserole type bars and stuff.
Okay. Bam. Okay, so if you could collaborate with any artist, they could be living or they could be gone, who would it be?
Oh, wow. Oh, I mean, there are a lot of newer artists. I'm blanking on Noah's last name, who sang Stick Season, who's really approaching his audience talking about mental health as a musician. So I feel like he's a great advocate. Jason Raz, I feel like, would be a great collaborator.
Yeah. And if you could master one skill instantly, and Angie, you'd have it, what would it be? I'd learn it instantly.
One skill, not being able to forget passwords. I'm constantly needing to reset passwords. That's a challenge. So being able to have a better system with cybersecurity of just having a password and then routinely changing it everywhere as opposed to resetting on 5 of the 10 apps. That is good. I struggle. That would be a good skill.
Yeah. Gretchen, I want to thank you so much for joining us today and sharing your story. Your work is a powerful reminder that advocacy comes in many forms. And sometimes the most healing and humanizing ones are creative ones. You've shown us that music therapy is more than a profession. It is a calling, a tool for connection, and a form of listening that goes deeper than words. To our listeners, if you're someone you love is navigating a tough chapter, whether it's a communication barrier, emotional challenges, or a life transition, remember that creative therapies like music can open doors you didn't know were there. Advocacy can be loud or soft, structured or improvised, just like music. What matters is that we keep showing up. Thanks for being here. Until next time, keep advocating, keep learning, and keep listening. Thank you.
Thanks, Rachel.